According to the CDC, more than half of all Americans will be diagnosed with a mental illness or disorder in their lifetime. Now imagine not being able to get the psychiatric treatment you need after that diagnosis. That's what roughly 2,500 defendants in Texas county jails are experiencing because the wait time for them to get state help can be years long. It can be devastating for families. But Williamson County plans to open a new facility to help cut down on that wait. Here's investigative reporter Jenny Lee.
Williamson County's new initiative is a mouthful and even longer to write. The Jail-Based Competency Restoration Program. The program is for defendants charged with a crime but have been deemed incompetent to stand trial. The goal is to get these inmates mental health care so they can get their day in court. Because in Williamson County, leaders say the process is just taking too long. What happens when an inmate has to wait 2 years before getting mental health treatment?
They get worse and worse.
And at a certain point, Williamson County Sheriff Mike Gleason says some of those defendants may never be competent enough to stand trial.
Their mental illness gets to where you can't bring them back. They can't come back to a competent level to help in their own defense.
According to the Williamson County Sheriff's Office, there are 8 inmates waiting for state psychiatric care. Out of that group, the shortest wait time is 295 days, or about 9.5 months. The longest wait time is 618 days, or about a year and 8.5 months. Sheriff Gleason says it wasn't until COVID-19 hit in 2020 that wait list became an issue. When he took office the following year, he says he started conversations with other county and mental health leaders about how to fix it, which leads us to the new program's first public look.
It's just the right thing to do.
Next to the Williamson County Jail, sit 6 pods like this one, the site of the county's first competency restoration project.
Because this is a big pod. This is the podlet.
Each pod contains 6 rooms, and each room contains 8 beds. Initially, the program will start with 1 inmate per pod.
You have fresh air.
Each large pod comes with a rec room. All areas will be monitored by staff and cameras at all times.
They're allowed to do regular physical activity as long as it's not hurting them.
Here, mentally disabled defendants will get the psychiatric care they need so they can stand trial. Bluebonnet Trails Community Services provide these experts.
They're not coming in with just a worrisome or bothersome issue. They're coming in with crisis. And so making sure that they have an immediate response from a professional team has been critical.
I think this is a perfect solution, and really others are doing it around the state.
Williamson County Commissioners approved moving forward with the Competency Restoration Program in its January 17th meeting. County leaders say while the state has already approved $1 million for a 12-month period, they are waiting for additional funding.
And we're also talking to the legislature about continuing and having continual funding for this project.
Before the program, Williamson County's felony mental health docket provided mental health care for those who couldn't get or didn't know about available resources, like Gabriel Benedict.
And I felt heard for the first time, ever.
Benedict says it wasn't until his 8th arrest that he finally got the help that changed his life. In 2019, Benedict was charged with felony possession of meth and his 3rd DUI in Williamson County. He says that was the first time a probation officer made the link between his arrests and mental health.
She said, "I can't believe you've been arrested this many times and no one has noticed that your mental health and your arrest record were coincided."
Benedict says he was diagnosed with major depression, post-traumatic stress disorder, and dissociative identity disorder, once known as multiple personality disorder. 47-year-old credits his probation officer, counselor, and other county staff for turning his life around. Benedict recently moved into his own apartment as he continues working on his 2nd book. He supports the Restoration Competency Program.
I feel like I can finally exhale.
I think every county would benefit from a jail-based competency restoration program.
Christy Taylor is the executive director of the Texas Judicial Commission on Mental Health. She says the 14 competency restoration programs in the state are doing well.
There is just an absolute overwhelm for the system.
Would you say it's at crisis levels?
I would say it's absolutely a crisis.
Let's take a look at that crisis in numbers. According to Texas Health and Human Services, the average number of individuals on the state waitlist for January is 2,531, a slight decrease from December, where the waitlist was 2,544. But a look at all of last year, and you can see how the number increased every month, with the exception of March to April, where it decreased by 8. Taylor says some of the factors behind that big wait list include population increase, staffing shortages, and not enough state beds. In 2021, the commission launched the Eliminate the Wait campaign, a checklist of strategies for courts, law enforcement, and mental health professionals to help reduce that wait.
The 88th legislature.
This legislative session, the commission is also recommending several changes to civil and criminal laws that would streamline mental health services for adults and juveniles. Taylor says mental health affects all Texans.
There may be a day when you have a family member who needs treatment and they can't get into a voluntary program because some of those voluntary commitments, those beds are being taken by these criminal cases.
That is not going to solve our healthcare problems.
But inmate advocacy groups like the Texas Jail Project, Mano Amiga, and Fierce Madres are against competency restoration programs. Instead, they're asking lawmakers to invest in mental health care treatment, housing, and prevention.
Nobody can get well in a cell, and we're lying to ourselves if we say that that's the case.
Until then, Williamson County leaders look forward to starting the new program.
But it will work out so much better for them and for the staff because they're calmer.
Helping defendants get their day in court and getting them out of the system.
Nobody should be sitting in jail waiting to be found competent.
For the KVUE Defenders, I'm Jenny Lee.
Jenny, thank you. Now, the Travis County Jail is also dealing with a long wait list. In 2022, the longest wait time for a pretrial inmate to get state help was 833 days. A Texas Health and Human Services spokesperson said 120 forensic beds were added in December to help with that wait list. Now, he also said the construction of a new hospital in Dallas will eventually add nearly 300 adult and pediatric beds to the state system in the years 2025 and 2026. For more on the state's efforts to end these wait times for defendants in the Travis County Jail, look for this story at KVUE.com.